Our last speaker today is very knowledgeable as a nurse. I'm very familiar with nurses. I had a lot of nurses when I was in OHSU for 92 days. I've learned that they are brilliant people. So Melissa's a nurse, and she's now an international speaker on these subjects of cancer and reproductive rights and so forth. So anyway, let's give Melissa a big hand. Melissa, welcome. Come on up here. Thank you, ma'am. Yeah.
Oh, thank you. I've been working with Jerry for a long
Couple decades.
Time. Yeah. Secrets and what goes on and on. Wonderful to work with, and I am so pleased that everybody's here. Everything everyone said here is absolutely not only on target, and I agree wholeheartedly, and even in my own talk, which is about medical and emotional type things, I have two things I want to tell you. The first one is that we probably all know, maybe personally experienced abortion ourselves. If this is the case, understand my talk is going to be about going over things. It will be a very kind of just touch point. It will or might, however, cause some people to feel uncomfortable in memories of the whole other things we carry in our own personal backpacks. So if somebody does, by any reason, feel that they've been, upset or distressed or something's coming back during the talk, please come up and talk to me or get my phone number. I'll get you resources and this type of thing. It's not meant to, really, make people feel badly or anything. It's meant to help. I just want you to remember that as parents, kids, grandparents, grandfathers, husbands, everything, this can affect everybody. So I just want you to know that there is support out there, and I don't want you to feel uncomfortable at all, okay? And the second thing that I'm kind of just sort of throwing out there is because in all this, and even my own presentation, the one thing that I didn't touch upon was about birth control pills. I worked OB/GYN care for a long time as a registered nurse, and one day I'm sitting there and I'm putting together information packets for patients. I came across progesterone-only pills and said, hey, wait a minute, this says it doesn't stop ovulation. This only says that it sloughs off or it stops the uterine lining from growing. Oh yeah, but don't put that in. If they knew, they wouldn't take it. Okay, so there's a huge impact with abortifactants and things that are not addressed in here. I regret not doing that, but I do want you to know that impact is huge theologically, economically, and legally, and of course within our own hearts too. Okay, so anyway, here we go. I am kind of passionate about this, so I'll do my best not to get really loud and run around, because I've been doing this since I was about 12 years old. So my expectations is that we will talk about the medical effects and the emotional, psychological effects of abortion. Please again keep in mind that this is something that I am doing just touching bases. I'm not going to go deeply into it because that would be about a 4 or 5 hour talk or a 2-day conference. I also put my own notes on here, so excuse me if every once in a while I look just to make sure I'm getting some of the term right. Medical, we have to talk about the abortion types, at least touch point on them, because that explains a lot of the reasons why we have complications from them. These are complications that are underreported. When they are reported, it's just an OB problem. I will refer to the baby as a baby just because you have different names for them throughout the time. Those names can easily be things from fetus to embryo, but just baby is going to be sufficient for me. Do know in medical terms they refer to the baby as a POC. That means products of conception. How dehumanizing is that? Okay, so medical abortion just essentially is medications. That is the RU486 pill. That's pills that they give them to prevent a pregnancy. It's used as a birth control. They give high doses of estrogens and progesterone in an effect to try to stop the pregnancy. Surgical is where a baby is removed, often from the uterus, and often from a vacuum device, syringe, spoon-shaped equipment with a sharp edge known as a curette. But also can use suction. It just depends, again, where that baby is at in the process of development or gestation. D&E is a dilation and evacuation. That's one particular one. It's not uncommon for some of these women to go to the doctor and they insert something called mistopropyl into the cervix, which forces it to dilate, and the baby would then, as they term it naturally, just become an abortion, and the woman goes home in many of these cases for the medicine one and the D&C. Partial birth abortion, in some cases this is highly controversial. Presumably it's not been allowed in many states. Reality is if you've watched the news, you've seen where Planned Parenthood sells the body parts. This is the type of thing that they do, and that is a hugely thing where they just partially deliver the baby and then remove the head by crushing it and suctioning. Some of the physical abortion effects. So you can see now as we go through this how that can affect not only the baby, the mother, but also the family. And we'll get a little bit more into that as we go. Growth, let's just go on to this. Carol Hogue is just one of many, many pro-abortion doctors. Some of the things that she wrote in her information to her patients just struck me as so ironic and so, I don't even know the word, just wrong. So she will tell them, here's the risks of abortion, namely, you could have heavy or persistent bleeding, you could have infection or sepsis. Sepsis is infection that gets to the rest of the body. Damage to the cervix from any number of different, especially the dilation, the forceful removal of the baby. Scarring to the uterine lining, which of course can happen using sharp instruments, and other ways. Perforation of the uterus, that just simply means that any equipment, anything can actually get through the wall of the uterus and cause scarring. Damage to other organs, most certainly around the area, and of course death. Here's the striking part to me that you don't see. There's no mention of the death to the baby. You know, and this is in her, all this stuff is in there, and time again. So ironically, her very same article added this. Your period should return in about 4 to 6 weeks after abortion, and you can get pregnant again real soon if you so choose to. You know, just wrong. Well, let's talk about breast cancer, a very controversial subject. Can abortion cause breast cancer? And the answer is yes. So then the question becomes, how? Now you'll know if you go through, like I have in the past, how many decades, I hate to imagine, but looking for research, quite frequently what you don't see is the research that they've done to show why these things aren't true. What they do is take the research that's been done by us and people who are trying to get an honest answer, and they spend a lot of time and money refuting it. So you don't see things so much on the other side as much as you see them taking our things and trying to make it something else. So let's talk just a little bit about that, because I am so glad you asked. Miscarriage. Let's talk about why that can cause it. So pregnancy, when you first become pregnant, as most women will tell you, the breasts become very sore. Why? Because a new hormone is being put into the body that's now going to begin the process of preparing for a baby's birth. So the cells in the breast at a cellular level start to proliferate. This is an important part of the development of that. So what happens then? So in a natural miscarriage, say the baby's died for whatever reason, the body recognizes this over a process of time, and it releases a hormone that reverses the effects of what was happening in the woman's body, including the breast tissue. That doesn't mean they'll be back to exactly where they were at, but it's pretty close. So then what's happening is the cells return to a normal state, or at least a fairly non-pregnant state. But what happens with abortion? So with the pregnancy, the breast tissue does proliferate, same as before. Abortion, the body does not recognize the loss of pregnancy. Why? Because there was no hormones secreted to the body that tell it to stop the proliferation of the microscopic breast cells. Okay, we just suddenly are pregnant and bang, you're not pregnant anymore. And so what's the cause? What happens there then is the breast cells remain in a highly proliferative state. Anybody that knows anything about cancer, what's happening with those cells? They are in a highly proliferable state. Nothing is telling those cells to go about their business and die and let other cells replace them, okay? And of course, scar tissue on the uterine wall. I could go on for days about what can happen. Just about any number of forms of abortion can cause this. When you use mechanical equipment, just remember Grandma's old rule and law. If you run with scissors or a pencil, expect to lose an eye, right? Well, you got sharp things where they don't belong, then this can happen. Additional effects on future pregnancy. Increased risk of the following for future. Vaginal bleeding during early pregnancy, preterm birth, low birth weight, placenta problems. Say that placenta goes up against the lining of the uterus where there's scar tissue. Well, it might not have a very good chance to actually adhere and allow that baby to survive. Incompetent cervix. Simply that means is especially after a certain amount of time with this or a weakened or damaged cervix, your body can actually learn to expel the baby. Because if you've done it again and again and again, you're training your body to do this. Okay, the Rh immune globulin therapy. So basically what this is, many women who happen to be what's called Rh negative, it's something in the blood. It describes some of the things. So if all of a sudden the baby who she is now carrying has Rh positive blood, what can happen is that if the baby's and the mother's blood intermixes, which it can during, say, an abortion or during birth, then what happens is that pregnancy, the mother's body develops antibodies. It recognizes that it doesn't belong. So that baby's okay. But what happens to the next pregnancy? Well, if you'll kind of look at this over here, you can see where here's the father, the baby, here, mother's got these little negative things, if you can see them. So now all of a sudden she's developed these antibodies. So the very next pregnancy, what's going to happen, just like a virus, her body's going to attack that pregnancy. Now, when somebody is normally pregnant and they go through all the regular care, they get a particular kind of medication that stops the production of antibodies. This is not always addressed in somebody who has an abortion. Okay, let's go to the emotional effects. And again, I'm trying to be very cautious. I'll go over some very common things and not too much into any one thing, because what I don't want, again, is to try to I think we're emotionally attached to the subject. I don't want to overdo that. Common grief responses: depression, sleep disturbance, suicidal thoughts, relationship instability, promiscuity, sexual dysfunction, addictions. Addictions, again, are probably, at least in a strong part, related to the fact now this woman needs to deal with this past, these choices that she has made, and she's self-medicating. Oftentimes, she will even go so far as to have multiple abortions just to prove that she can and that it was okay to do in the first place. It becomes a never-ending cycle in many cases. Longer list of different things. This is a whole different article that I read, but of course it can hurt. If you have a husband or a boyfriend and you have this abortion, of course naturally that's going to cause at least some form of stress in that relationship. Guilt, ouch. A mother's heart's genetically designed to protect the child at all costs. Abortions can short-circuit that basic human instinct, leading to feelings of guilt. And it's not uncommon for women with abortion to have a form of PSTD, or post-traumatic stress disorder. The symptoms may include that the individual believes that these bad events that are happening to her, even if she doesn't recognize it as, quote, her fault, but that she may still feel that she somehow or another deserves to have these other problems happen. So what can happen? Well, they might want to try to get pregnant again really quick just to be sure they can. A lot of times, some of the lies that are spread to a woman who has an abortion, she believes this is a glob of tissue, that it's not going to affect you in any way, you're going to be free from here on out. And then when they hear anything different, that resonates with them, and that can cause a lot of problems. Some of the PTSD that can happen as they, in their mind or in their dreams, continue to experience that abortion over and over again. And then, of course, they do have a fear of infertility. Additionally, there's depression or anxiety. They may avoid children. In other words, what I call having a child sterile life. You know, they just go out and have fun. They do this, they do that, and they do everything they can to not be around children because that's a constant reminder. They also may become numb emotionally. They don't want to share their thoughts, their feelings. There's always something, a cloud that's overriding even if they're not thinking about it. It's not uncommon to get depressed, thoughts of suicide because they can't even necessarily identify where all this is coming from. Anniversary reminders may either be on the day that they had the abortion or abortions, or knowing about when that child would have been 1-year-old, 2-year-olds, 3-year-olds, and the like. And that's effective even if they don't realize that that date's coming up, their body remembers. This is something that I have to address, and I feel strongly that this is very important. Many of the laws in many of the states, and if Andrew got into that, I'll probably be able to tell you, the families are not consulted, and oftentimes in some states, it's not even a requirement for the woman to tell the husband that she's going to have an abortion. This is also true in our schools, folks, because the reality is, in many of the schools, at least particularly I want to say in California, I haven't done that much research, I just know this to be true. Not only can the school counselor or a teacher take your child or your grandchild to Planned Parenthood or an abortionist, but they can also bill your insurance, not tell you what it is, it will be nondescript, and suddenly mom, dad's getting this bill, or they didn't even bother to tell you, and they rightfully can not tell you that they've taken your child to have this done. So, this is loss of parental rights. This is loss. I mean, it's very huge, but it's a big business. This particular one, this picture just broke my heart. He goes, "I regret lost fatherhood." Somehow or another, this particular gentleman might very well have felt responsible and somehow maybe not supporting this person, maybe actually encouraged, maybe just not standing up or saying anything. I mean, I don't know his particular circumstances, but that was a kind of crushing picture. This here is something else, and this is what I call a toxic statement. Things that people say to us when they want you to feel better after something bad has happened. So one must rationalize that we made the right decision for ourselves and the child. Friends and family often confirm this denial and the dismissal of any feelings, thereby not allowing those feelings of regret or pain with comments such as, "Well, now you can get on with your life. One day you can welcome a baby into this world when you are ready to start a family." I just let that one sit because that's not much more that needs to be said. This here is something that meant a lot to me. There's a lot of activists, and I particularly pulled out Alveda because she's the niece of Dr. Martin Luther King. Incidentally, just know that Roe and Roe versus Wade, Norma McCorvey is actually now one of the strongest pro-life people in this country, and she goes out and speaks about it everywhere. You can look that up, and it's pretty fascinating what she's accomplished. So Alveda had gone out to say that she is strongly, strongly pro-life. Many people already be familiar with her. One thing that I find is that she said that the pro-life movement is a continuation of the civil rights struggle. That's profound. That's profound. The second thing, and this is really interesting, she's a best-selling author, but among her books is something called "How Can the Dream Survive If We Murder the Children?" Okay? Profound. And there's many other things and books out there, but this one just struck me as so appropriate to this particular topic. There's so much else to go over, so many other conversations that can happen. This is a starting point, and I truly, truly, truly do thank you for coming and listening to us tonight and joining us. Thank you.
Thank you, Melissa. Wow. So much knowledge. Thanks, everybody, for being here. We appreciate it. Now we're going to have time for questions. If anybody has any questions, we have the experts here. Yes, ma'am. You have a question?
Is it true that here in Washington, it's a double homicide if you murder a pregnant woman?
The question was for the panel, is it true in the state of Washington that if you murder a pregnant woman, it could be considered a double homicide?
There are some circumstances where that is true. Yeah, there are some circumstances where that is true. It certainly depends on the facts are what's going to tell the prosecutor, how many, whether he has probable cause to charge both or not. And so you'd also have to have separate, murder, so each crime is, contained in each crime is an actus reus, which is the act itself, and the mens rea, which is the mental state. And so you would have to prove independently that the mens rea was to kill the child as well. That's probably why you don't see a charge very often, because you have to have independent mens rea, and that can be difficult to establish in most fact patterns. But yeah, it is allowable under the law, it's just very rarely charged.